In this discussion, we are going to see about the public health education in India. Now, the reason for discussing this is recently there is a news about US withdrawal from WHO and USAID. So, this withdrawal of US has created a reduction of funds for global public health. See, global public health infrastructure is a very important one, and we have witnessed it during the COVID-19 pandemic. So, the importance of specialized public health workforce is a very essential one. But the recent withdrawal of US from this department has created many impacts on the global public health. So in this context, we are going to discuss about the public health education in India, how it has evolved in India. The public health education started during the colonial era, and it was initially part of a medical teaching. An important milestone was reached with the establishment of All India Institute of Hygiene and Public Health in Kolkata, and this was established in the year 1932. Before 2000, the public health specialist mainly came from the community medicine field, and also there are only few experts in this field in India. So because of this, many Indians chose to pursue their Master of Public Health foreign countries because there were only limited options in the India. But after 2000, the situation has changed dramatically. Number of institutions who are offering the Master of Public Health courses are increased significantly in India. So this growth coincided with the launch of National Rural Health Mission in 2005. So this launching of this National Rural Health Mission has created more public health opportunities across the country. In addition to this, Article 47 of Indian Constitution emphasized the government's responsibility to improve the public health. So this has also helped to reinforce the importance of public health education. Recently, the COVID-19 pandemic also highlighted the urgent need for specialized public health professionals. Now if you look at the global reductions in international aid for public health, India has a resilient public health system compared to other countries. Even though this is a positive development for India, there are several challenges which remain in the public health education. Firstly, the significant supply-demand mismatch. The number of MPH programs, that is Master of Public Health program, have increased rapidly, but the number of available public health positions do not keep up. So this has created an intense competition for limited job opportunities. There are only limited MPH vacancies, but there are many people who are pursuing this MPH, that is Master of Public Health. In addition to this, the government recruitment in public health has also slowed down. The private sector also prioritizes other specialization instead of public health. So the private sector is also not hiring many public health specialists. The government is also not recruiting enough public health specialists. So this has created supply-demand mismatch. There are many people ready to pursue this public health, but there are limited job opportunities. So this is an important challenge in India. Another important challenge is the quality of education. The Ministry of Health has set a framework for this public health education, but there are a lack of standardized curriculum and clear outcome measures. There is also lack of uniformity among the public health education institutions. In addition to this, many MPH programs do not provide enough practical learning opportunities. So the faculties lack the real world experience. There is also absence of a dedicated regulatory body for this MPH training. So this results in difference in quality of education offered by different institutions across India. So these are the important challenges in pursuing the public health education in India. In addition to this, the funding constraint is also another challenge. The international aid was reduced recently, and institutions which relies on the external funding are heavily affected. In addition to this, the national funding for research and health development remains very low. The global funding is also reduced, and the national funding is also not keeping up. So this has created a funding constraint for the public health institutions. The next important challenge is geographical disparities. See, many undeserved and remote areas lack the access to quality public health education. So this creates unequal opportunities for aspiring professionals. Now look at this prelims practice question. What is a major challenge in India's public health education system? The correct answer is option C, supply-demand mismatch. With this, let us conclude the discussion and move to the next topic.